Hi, I am Sm. In this video, I demonstrate you the examination of thyroid gland. For examination of thyroid gland, you just started your examination by reading introduction, constant, then exposure. For exposure, you just open up the first button and expose like this. And then you have to ask him some question like, what's your name?
My name is Adnan.
His name is Adnan and he is from ICMC 12. Help me to demonstrate this examination. And I know his name, but I check her voice because you get hoarseness of voice in case of hypothyroidism. And then you ask for, do you have any alteration of bowel habit?
No.
He doesn't have any alteration of bowel habit. You know, in case of hypothyroidism, you get constipation. In case of hyperthyroidism, you get diarrhea. Do you feel excessive cold or hot in normal environment?
No, it's not one.
You know, in case of hyperthyroidism, there is heat intolerance, and in case of hypothyroidism, there is cold intolerance. And then, if you get any obvious swelling, then you ask for how long it's present, is it painful or not, and is it persistent all time, and whether it is progressively increasing or not. And then I just examine proper the thyroid gland. For proper examination of thyroid gland, you have to sit in front of the patient and then ask the patient to swallow Rogaine. Just inspect the thyroid gland. Then you have to examine 3T, that is temperature, tenderness, tracheal position. Temperature, tenderness, tracheal position. Check the temperature first normal, then abnormal, then again normal, and then tenderness. Press over the thyroid gland. Look at the face of the patient and see any check in the facial expression, and then check for tracheal position. Trachea is shifted by enlarged thyroid gland, and then I just palpate the thyroid gland from back, from in front, we check temperature, tenderness, tracheal position, and then go back and palpate the thyroid gland. For palpation, you have to put your thumb over the occipital area, index finger above the swelling, little finger below the thyroid gland, and other finger just over the thyroid gland, and ask the patient to swallow Rogaine, and notice the extension of any swelling, and then palpate the thyroid gland by rolling method. It is called rolling method. Fix your one hand and palpate by other hand by rolling. And if you get any obvious swelling, palpable obvious swelling, then you check the fixity, and then check the lymph nodes, cervical lymph nodes, submental, submandibular, jugulo-digastric, anterior chain, supraclavicular, posterior chain, occipital, preauricular, and then postauricular. And then we go for two signs. First of all, we go for Berry sign, palpate the cavity pulse. You do not get the cavity pulse if there is malignant infiltration of malignant cell in cavity sheath. You do not get the cavity pulse. Don't check the cavity pulse bilaterally. Check right side first, then left side. And then we go for Cocker sign. Press over the thyroid gland and ask the patient to breathe in by open mouth. Shashna, Hagore Shashna. This is called Cocker sign. In case of enlarged thyroid gland, you may gain positive Cocker sign. And then we go for eye signs of the thyroid gland. We see 6 eye signs. First of all, we see Napziger sign. Then we go for lead lag, lead retraction, Mobius sign, Joffice sign, then styloid sign. First we go for Napziger sign. For Napziger sign, you just head position like this. And in case of Napziger sign, positive Napziger sign, you are able to see the eyeball over the supraorbital disc, because eyeball is protruded in case of hypothyroidism. Eyeball is protruded in case of hyperthyroidism, and that is called thyroid ophthalmopathy, common finding in case of Graves' disease. And then come in front and look for lid lag, lid retraction. For lid retraction, you are able to see the upper bulbar sclera. Lid is retracted like this in case of hyperthyroidism. And for lid lag, you have to check the lid lag. In case of lid lag, when the eyeball is moved, the eyelid is lag behind. This is called lid lag. And then you go for Mobius sign. Dure dike takan. Dure dike takan. And that is called Mobius sign. Convergence of the eyeball. You do not get the convergence of the eyeball in case of hyperthyroidism because eyeball is bulged out and cannot converge. And then you go for Joffrey sign. Upor dike takan. Joffrey sign. In case of hyperthyroidism, patient able to see the ceiling without furrowing in the forehead. And this is called Joffrey sign. And observe the styloid sign. Styloid sign is inadequate blinking. And then come in front and sit in front of the patient. And check with the patient. Check whether the hand is warm, sweated. And then you go for pulse. Is there any tachycardia? You know tachycardia present in case of hyperthyroidism and bradycardia present in case of hypothyroidism. And then you go for fine tremor. You check it by finger over the hand and check any fine tremor is present or not. And you just end up your examination by thanks to the patient. So quick recap of examination of thyroid gland. You just started with examination of thyroid gland by greeting, introduction, consent, then exposure, then ask some question, and then the proper examination of thyroid gland. Sit in front of the patient and look for ask the patient to swallow Dogelin, and then you go for 3 things: 3T: temperature, tenderness, tracheal position, and then go back and palpate the thyroid gland by rolling method. Then take the cervical lymph nodes, and then go for 2 sign: Berry sign, palpate the carotid pulse. Then go for Cocker sign, pressure over the thyroid swelling, and ask the patient to inspire by open mouth. And then you go for eye signs. First of all, we see Nafziger sign. Then you go for lid retraction. For lid retraction, you are able to see the upper bulbar sclera like this. And then you go for lid lag. Then you go for Mobius sign. Dure dike takan, amar angulir dike takan. And then you go for Joffrey sign. Ceiling er dike takan. And then you go for styloid sign. Inadequate blinking. And then you again sit in front and check with the patient. Check the radial pulse. Check the fine tremor. And this is all about examination of thyroid gland. Thanks for watching.